Can everybody introduce yourself, please?
Uh, yes. Hi, my name is Saya.
I'm Ryan.
I'm Michael.
Kaylee.
I'm Jesse.
All right, thank you. Good day, everybody. My name is Josiah. And today we're going to talk about drugs. No, we're not going to talk about your typical illegal drugs such as methamphetamine or cocaine. We're going to talk more about medical drugs such as anabolic steroids and corticosteroids. Anabolic steroids, also known as performance enhancing drugs or PEDs, is usually like a drug taken to boost one's physical attributes for uses in like sports, or it can help with body recovery. Corticosteroids, which is the more medicated version of the steroids, is like an anti-inflammatory drug used for like many different reasons that we're going to go into later. Why would somebody use PEDs or anabolic steroids? Really and truly, especially in the world of sports, anabolic steroids are used to gain an advantage, and this is the main reason why it's illegal in most sports. Besides some sports, such as like some events in powerlifting and also some events in professional bodybuilding as well. The most common use PEDs or anabolic steroids is stuff like trenbolone, testosterone, Anavar, SARMs, and stuff like that. These are the most common used steroids in the world of bodybuilding. There's also another form of steroids called TRT or testosterone replacement therapy. This is the type of steroid used for individual that like their body can't even produce its own natural steroid use anymore after abusing anabolic steroids for so long. There's also positive uses of steroids, though, and this is the corticosteroids. These steroids are used as anti-inflammatory medicines, as mentioned earlier. Some uses can be like the hydrocortisone cream that some people use. Uh, Creams for things such as eczema are also used as corticosteroids. Some oral uses of corticosteroids are like the inhalers for asthma, like users. Also, you have like the nasal sprays and stuff like that to clear congestion and things of that nature. And also, corticosteroids can be used as to help with immune system problems such as arthritis, sciatica, like, and in some severe cases, lupus. There's also another there's also another side effect, like major side effects of anabolic steroids and corticosteroids if abused in non-clinical dosages. The physiological side effects usually include severe acne along the face, the chest, shoulders, and back. You can have extreme liver damage, which usually puts people on dialysis machines and such and such. And then you could also have stunted growth. The stunted growth usually happens to like young individuals, like let's say in their teens or whatever. It just causes issues with the fusion of bone plates around the joints and in the bones itself. There's also psychological changes as well. A lot of people see sexual aggressiveness, which stems from the testosterone levels being much higher than normal. But then we also have abnormal criminal behavior, also known as roid rage, amongst the media. And this is usually individuals that just they're mad for like like really small stuff. There's also gender specific issues when it comes to steroids. For males, there's usually the like pattern baldness that many men see. You also have the shrinking of the testicles, which also in ties with or like the reduction in sperm count, so it's just much harder to have children later in life. Men also develop like women breast tissue called gynecomastia, which is you can really see it in athletes that fight like shirtless. You can see it in their like nipple region. For females, they really have the deepening of the voice, and then they also have like an increase in the growth of facial hair on their chest, stomach, and also on their back as well. Now, I really think this topic is important because since relatively COVID 19, so between 2019 and 2021, there's been a really massive surge in the use of steroids, mainly anabolic steroids, which were used in non clinical dosages. And I feel this stems from social media. There's a lot of like fitness gurus and fitness models that many average people like myself try to aspire to be. And the easiest way to do it and avoid some of the hard work aspect is just to use steroids. But steroids do have its really negative effects, and we've also had like its negative effects shown in social media where there are some people that have died from the use of anabolic steroids in non-clinical dosages. That's all. Thank you for my speech.